Hello students, today we will discuss about the anatomy of median nerve. Now in today's lecture we will see the formation of the median nerve, the course of the median nerve, and we will see the branches of the median nerve. Now when we will see the median nerve, it is known as the nerve of forearm. Now this is the important concept to understand, that when you will talk about the arm, in the arm you have the biceps brachii, you have coracobrachialis and brachialis. All these three muscles supplied by the musculocutaneous nerve. So this is the question which you have to understand, that in the arm you don't have any branch from the median nerve. Median nerve basically supply all the muscles of your anterior or the flexor compartment of the forearm except the two muscles. One is known as flexor carpi ulnaris and the medial half of flexor digitorum profundus. So these two muscles of your forearm supplied by the ulnar nerve. Remaining all the muscles supplied by either median nerve or its deep branch, that is anterior interosseous nerve. So this is the important concept to understand, that median nerve is a nerve of forearm. Now there is one more important term which used for the median nerve is laborer's nerve. So it is known as laborer's nerve as it supplies most of the muscles of the forearm and the thumb which require for the crude movement which is done by the laborers. So there are two questions in this slide. First question is that median nerve supply muscles of the forearm except 1.5 muscle. Which is the half? It is half of the flexor digitorum profundus, and which is the one? Flexor carpi ulnaris. And it is also known as laborer's muscle because it supplies the all muscles which are responsible for crude movements. Now it is formed by the joining of medial and lateral roots of the median nerve in the lower part of axilla. Now in this diagram you can see that this is our median nerve, and this median nerve form in the axilla. Later on it will continue downward and it crosses the elbow joint, enters into the forearm and ultimately terminates into the wrist. Now when you will see the whole course of this median nerve, you have to understand that median nerve is formed by the two components. One is known as lateral root, one is known as medial root. These are not the root of brachial plexus, these are the root of median nerve. Now the lateral root of median nerve is continuation of lateral cord, and you know the root value of lateral cord is C5, C6, C7. So the lateral root of median nerve carrying the fibers from the lateral cord with C5, C6, C7 fibers, while the medial root of median nerve is deriving from the medial cord which is carrying the fibers of C8 and T1. Now here you have to understand this part, that this is your medial cord of brachial plexus. Here you have lateral cord of brachial plexus. Now from the medial cord you are having the origin of medial root of median nerve. So this part is known as medial root of median nerve, and this part is known as lateral root of median nerve. These are not the root of brachial plexus, these are considered as the root of median nerve, and both the root is joining together to form the median nerve. Clear? So median nerve is having the two roots. Now what is the root value? For the lateral root it is C5, 6 and 7. For the medial root it is C8 and T1. Now the important thing comes is that medial root crossing in front of the third part of axillary artery. Now this is the important concept to understand, that when you will see the formation of the median nerve, it form on the lateral side of the artery. Now here you can see that this is the nerve, and where is the artery? You can appreciate that this is the artery. So when you will see the artery and when you will see the nerve, what you are able to understand, that nerve is on the lateral aspect of axillary artery. Now how this nerve is come on the lateral side? Because this medial root crosses the artery from its front and it joins the lateral root on the lateral side, and that's why the nerve comes on the lateral aspect of third part of axillary artery. So the medial root is responsible for this formation on the lateral side because it crosses the front of the axillary artery. So, the commencement of the trunk of the median nerve is on lateral aspect of third part of axillary artery. This is very commonly asked question in your exam, that commencement of the median nerve is anterior to the artery, lateral to the artery, or medial to the artery. Answer is, it is lateral to the artery. Why it is lateral to the artery? Because this medial root crosses the artery from its anterior aspect. Now, what is the course? After the formation in the axilla, the nerve enters the arm at the inferior margin of teres major. Now, it is always a very important landmark, inferior margin of teres major, between the starting point of the arm and ending of your axilla. Now, from this lower border of teres major, in upper part of the arm, nerve still remain lateral to the brachial artery. Now, the term has been changed, it is no more considered as axillary artery, because you know at the lower border of the teres major, third part of axillary artery continue as brachial artery. But still, this nerve lies in lateral relation to the artery. Now, what will happen in the middle of the arm? Now, in the middle of the arm, you can see here that this nerve is medially here and this nerve is laterally into the upper part. So, in the upper part, nerve lies laterally, but in the lower part, nerve lies medially in relation to the artery. That means, at one point, the nerve is crossing from lateral to medial side. So, this crossing from lateral relation to medial relation of the artery, the crossing occurs somewhere in the middle or lower middle of the arm. So, the nerve crosses in front of the artery and it comes from lateral to medial side, and in lower part now you will realize that nerve descend on the medial aspect of brachial artery. Clear? So, this is the very important question for your exam, that in upper part nerve is laterally, in lower part nerve is medially, and in this middle portion it is crossing from lateral to medial in front of the artery. Now, when you will go more in the lower part of the arm, you will find that here you have the fossa is known as cubital fossa, which is a depression in front of elbow joint. In cubital fossa, nerve lies on the medial side of the brachial artery and it lies on the brachialis muscle. Now, I hope that you have the idea about the cubital fossa, that the floor of the cubital fossa is formed by the brachialis muscle in supinator, and this nerve is the medial most structure in the cubital fossa. Now, here you can see that this is the nerve in the cubital fossa, which is most medial structure. Now, next to that you will have the brachial artery, next to that we have the biceps tendon. So, this is the important question for your exam, which is the most medial structure in the cubital fossa. Answer is nerve. Which nerve? Median nerve. Now, here if you will see from the side of the cubital fossa, what you can see, this is the origin of the pronator teres. Now, this pronator teres is having two heads. This head is coming from the medial epicondyle and this head is coming from the ulna. So, you know that there are two heads of the pronator teres, one is ulnar head and one is humeral head. And now, what is the important thing? The important thing is that this nerve is passing between the two heads of this pronator teres. So, this is again become the question for your exam, that which nerve lies between the two heads of pronator teres? Answer is median nerve. Now, one more important thing is that it leaves the cubital fossa between the two heads of pronator teres and the deeper head of pronator teres. That means, ulnar head of pronator teres separates this nerve from a artery and this artery is your ulnar artery. Clear? So, you have to understand the relation in the upper part of forearm and cubital fossa, that the artery is most medial in the cubital fossa, then it leaves the fossa by passing between the two heads of the pronator teres, and below the deeper head of pronator teres you have ulnar artery. So, ulnar artery is remain separated from the median nerve by the deeper head of pronator teres. So, now the nerve enters the front of the forearm between the humeral and ulnar head of pronator teres. So, this is the question. Then sometimes the nerve get compressed or entrapment of the nerve will take place. Now, this is again the question of your exam, that which nerve causes compression of median nerve in cubital fossa? Answer is pronator teres, because the nerve is passing between the two heads and sometimes both the head may compress the nerve. Now, here it separates from the ulnar artery by the deep head of pronator teres. So, now in this diagram, what you can appreciate that this is your superficial head of pronator teres, which is known as humeral head. Now, this is your ulnar head. Between the ulnar head and the superficial head, you can see that nerve is present here. Now, apart from that, deep to this ulnar head, you can see the ulnar artery. So, what is the question for your exam? The question for your exam is, which structures lies superficial and deep to the ulnar head of pronator teres? So, the superficial structure is your nerve and deep structure is ulnar artery. Clear? And this is the site where the entrapment or compression of median nerve may occur between the two heads of pronator teres. Now, what is about the course in the middle of the forearm? Now, when you will see, once the nerve is passing below the two heads of the pronator teres, nerve now come under cover of the fibrous arch of flexor digitorum superficialis. So, how the nerve enters into the forearm? First, we have seen in the cubital fossa, below the cubital fossa, between the two heads of pronator teres, below the pronator teres, there is a fibrous arch of flexor digitorum superficialis. Now, flexor digitorum superficialis, when you can see, is also having two parts. One is here and another is here, which is a major origin from the oblique line of radius. Now, between these two heads, you are having a fibrous arch. So, now here what is the important thing to understand, that this now is going deep to this fibrous arch. So, that is why this nerve is not visible here. So, now the question comes is that here it lies between the superficial and deep muscles of the flexor compartment. Now, what are the deep muscles of flexor compartment? You have flexor digitorum profundus, you have pronator quadratus. So, this nerve is now become sandwiched between the superficialis muscle and profundus. Now, it descends vertically and very closely applied to the posterior aspect of flexor digitorum superficialis. Now, my dear students, this question comes is so many times, that which structure plasters the posterior surface of flexor digitorum superficialis? What does it mean? That name the structure which very closely adherent to the posterior surface of flexor digitorum superficialis. So, if I will make a blind cut on this belly of flexor digitorum superficialis, I definitely cut the median nerve, because median nerve once it enters deep to this fibrous arch of flexor digitorum superficialis, it runs very close proximity of the posterior surface, which is termed as which structure plasters the posterior surface or closely applied to the posterior surface. Now, here you can see that these are the two images which you are able to appreciate here, that once the nerve is entering here through the fibrous arch, it is closely related with the posterior surface. Now, here you can see that this is the posterior part of the forearm, where you have the anterior surface of your bones of the forearm and interosseous membrane. But if you have the placement of the deep muscles, which are here, you can see this is the placement of the deeper muscles of the forearm, which is not in this image. So, now you can differentiate that nerve is present between the two layers of the muscle. Which layer? This is the deeper layer of the muscle and this is the superficial layer of the muscle. Now, here we have removed the deeper layer of the muscle, which should come here. So, the nerve lies between the superficial and deep layer of the muscle once it enters through the fibrous arch, and it plasters the posterior surface of flexor digitorum superficialis. So, here in this area it becomes sandwiched between the superficial layer of the forearm muscle and deep layer of the forearm muscle. So, this question is very commonly asked in your exam, that which muscle is having the posterior close proximity of the median nerve in forearm? Answer is flexor digitorum superficialis. Now, in the lower part of the forearm, about 5 centimeter proximal to the flexor retinaculum, the median nerve emerges on the lateral side of the tendon of flexor digitorum superficialis. So, again, this is your flexor digitorum superficialis, and these are the tendons which is going for the different digits. That is why it is known as flexor digitorum superficialis. Now, when you will see the exit of the nerve, you can see that nerve lies on the lateral aspect of flexor digitorum superficialis. So, this is the nerve, clear? So, what are the two questions come again here? That when you are talking about the course in the lower part of the forearm, you have the median nerve, but now it is not covered by the flexor digitorum superficialis. It comes on the lateral aspect of the tendons of flexor digitorum superficialis. Then the second question is that it lies between the tendon of palmaris longus and flexor carpi radialis. Now, again, when you will see this diagram, you have to understand that there are two more superficial tendons. Now, this is the tendon of flexor carpi radialis. This is flexor carpi radialis, and this tendon is palmaris longus, which anteriorly will go and continue as a palmar aponeurosis. Now, in between these two tendons, you are having this nerve, and this is your median nerve. Clear? So, what are the two questions we discussed here in this image? That once you are having the exit of this median nerve below the flexor digitorum superficialis, it lies just next or lateral to the bundle or bunch of the tendons of flexor digitorum superficialis. More specifically, it comes between the tendon of palmaris longus and flexor carpi radialis. Clear? Now, what happened at the wrist? Now, at the wrist, median nerve passes deep to the flexor retinaculum, which is known as carpal tunnel, and ultimately it enters into the palm. So, here you can see that you are having the placement of flexor retinaculum, and deep to the retinaculum you are having the carpal tunnel. So, the nerve is entering into the palm. Now, what will happen into this palm? The nerve ultimately lies medial to the thinner muscle. Now, here you have the muscle which are supplying responsible for the movement of thumb, which are known as thinner muscle. So, nerve is related on the medial side of thinner muscle, and here it terminates into the medial and lateral branches. So, what will happen? That this is the lateral branch and this is the medial branch of median nerve. So, we started from the high in axilla, that is the formation, then it passes from the arm, cubital fossa, forearm, then it enters into the carpal tunnel, and once it enters into the palm, immediately divide into the medial and lateral branches. Now, the ulnar and median nerve found deep to the superficial palmar arch. The arteries are usually superficial to the nerve. Now, what does it mean? Now, this is very important question, that whenever you are dissecting your palm, you will realize that the ulnar and median nerves are deep to the superficial palmar arch, which you can appreciate in this diagram, that this is the arch. Now, the arch are always superficial to the nerve. Arches are, this is the arch, and arch is always superficial to the nerve. That means, suppose this is my superficial arch, then the median nerve and ulnar nerve comes here. So, these are the deeper structure as compared to the superficial palmar arch. Now, this is important to understand, that if you are dealing with the palmar arches or blood vessels of the palm, you have to keep this thing in mind, that nerves are lies below the arch. Clear? So, this is again the important question for your exam, that whenever you are tracing the arteries, you will find that the arteries are generally superficial to the median and ulnar nerve and its branches. Now, what are the branches of median nerve? I told you already that in axilla you don't have any branch, and in arm it is giving the branch to the pronator teres, but the pronator teres is a muscle of forearm. So, the nerve to the pronator teres arises before the nerve is entering into the forearm. So, this is the only branch of median nerve which arises in the arm, but still it is supplying the muscle of forearm. Clear? Then in the cubital fossa, it is supplying the flexor carpi radialis, palmaris longus and flexor digitorum superficialis, which are the muscle of the superficial group of forearm. And these branches originate from the nerve just distal to the elbow joint. So, what are the branches till the cubital fossa? In the axilla, no branch. In the arm, no branch, except in lower part you have a branch to the pronator teres. Remaining superficial muscle, that means flexor carpi radialis, palmaris longus and flexor digitorum superficialis, supplied by the branches of median nerve, arises in cubital fossa. Now, there is a one very important branch of median nerve which is known as anterior interosseous nerve. Now, anterior interosseous nerve is the largest branch of the median nerve which comes in the forearm. It originates between the two heads of pronator teres and it passes distally downward in the forearm with anterior interosseous artery. Now, in this image, you have to first identify the interosseous membrane. So, interosseous membrane is here. Now, this interosseous membrane is having a nerve on its anterior surface, and this anterior surface nerve is anterior interosseous nerve. So, anterior interosseous nerve is running in very close proximity of your interosseous membrane. While I told you that this main trunk of median nerve is running in very close proximity of posterior surface of flexor digitorum superficialis. Now, in this diagram you can see that this is the anterior interosseous nerve which comes out from this median nerve just near to the pronator teres muscle. So, this is the important nerve that it is the largest branch which arises in the forearm and it passes distally in the forearm with anterior interosseous artery on anterior surface of interosseous membrane. Now, this anterior interosseous nerve innervates the deep layer. Now, we have seen that the main trunk is become sandwiched between the superficial and the deep layer of the forearm, and the main trunk supply the all superficial muscles, and deep group of the flexor muscles of the forearm supplied by the anterior interosseous nerve except 1.5 muscle. So, which are the muscles supplied? One is the lateral half of the flexor digitorum profundus, because its medial half is supplied by ulnar nerve. Then it supplies the flexor pollicis longus and pronator quadratus. So, the median nerve is ultimately supplied superficial group directly and deep group by its anterior interosseous nerve. Now, this nerve ultimately terminates into the joint. It does not enter into the palm. The palm receives the main trunk of median nerve. The anterior interosseous nerve ends at the inferior radioulnar joint and the wrist joint. So, this is the important thing to understand, that anterior interosseous nerve which is running here is supplying the deep muscle, like it is supplying pronator quadratus, it will supply this flexor digitorum profundus. Clear? While these superficial muscles like flexor digitorum superficialis, it is supplied directly by the branch of main trunk of median nerve. Now, there is a one more important branch of median nerve is known as palmar cutaneous branch. Now, this palmar cutaneous branch arises near the wrist joint. So, it is a very small branch of the median nerve which arises immediately proximal to the flexor retinaculum in distal forearm near the wrist joint. So, here you can see that this is your flexor retinaculum. Now, just above the flexor retinaculum, this is your main trunk of the median nerve. Now, from this main trunk of median nerve, you can see this purple color nerve, and this is your palmar cutaneous branch of median nerve. Now, this palmar cutaneous branch of median nerve lies superficially. What does it mean? That it is not passing through this carpal tunnel. So, tunnel is giving passage for the main trunk of median nerve, not to this palmar cutaneous branch. palmar cutaneous branch remains superficial to the flexor retinaculum. And this cutaneous branch, as the name itself suggests, it supply the skin. So, it supply the skin over the your base of the thumb and central part of the palm. So, this is the very important question in your exam, that if there is a injury of median nerve inside the carpal tunnel. Now, if the median nerve is injured inside the carpal tunnel, the cutaneous sensation of your this part of the skin remain preserved. Why? Because this branch arises earlier before the site of injury. Clear? So, this palmar branch is spared in the carpal tunnel syndrome. So, this is very important question, that it is spared in the carpal tunnel syndrome. Why? Because it passes into the hand superficial to the flexor retinaculum. Now, what are the further branches in the palm? Now, we know that in the palm it terminates by dividing into the medial and lateral branches. So, first we will discuss the medial branch. Now, the medial branch gives the two common digital branches. What are these two common digital branches? Now, here you can see that this is the medial branch. Now, this medial branch is giving this digital branch and the second digital branch. Clear? So, there are two common digital branches arises from the medial branch of median nerve. Now, this lateral communicating common digital branch is further divided, and it supply the adjacent side of index finger and middle finger. So, here you can see that this is your thumb, this is your index finger, this is middle finger. Now, this lateral digital branch of median nerve is dividing for the branches to adjacent side of these two fingers. While you are having one more small branch here. Now, this branch is supplying a muscle is known as second lumbrical. Clear? So, there are two questions from this slide. First is that there is a termination of median nerve by dividing into the medial and lateral branch. This medial branch supply which area? So, medial branch supply the index finger and middle finger adjacent side. Adjacent means the side which are facing each other. So, they are supplying the sides of the middle and middle and index finger adjacent side and second lumbrical, plus the medial communicating branch supply the adjacent side of the middle and ring finger. So, where is the middle and ring finger? So, this is again the middle finger and this is the ring finger. Clear? So, you have the two branches from this medial branch. This is your index finger, this is your middle finger, and this is your ring finger. Clear? So, this now is supplying the adjacent side of index and middle, and this now is supplying adjacent side of ring and middle. Apart from that, this branch is also supplying the second lumbrical. Now, what about the lateral branch? Now, this is the lateral branch. Now, this lateral branch is also giving one additional branch which is here. Now, this smaller branch is known as recurrent branch of median nerve. Now, this recurrent branch is a muscular branch which supply all three short thin arm muscle like abductor pollicis brevis, flexor pollicis brevis, and aponensis pollicis. So, all these three thin arm muscles are supplied by this branch which is known as recurrent branch of median nerve. Then this median nerve will divide and supply the thumb. So, this is the thumb, and you will have the two branch on both the side of the thumb, and you have this side of the index finger which left from the to be supplied by medial branch. Clear? So, ultimately you have to understand this thing that there are 3.5 sides which has been supplied by the median nerve. Two sides, both the sides of the thumb, both the side of your index finger, both the side of your middle finger, and the lateral side of your ring finger. Remaining three sides, two sides of the little finger and this medial side of the ring finger supplied by the ulnar nerve. So, this 1, 2, 3 and half. So, 3.5 fingers supplied by your median nerve, and remaining 1.5 is supplied by ulnar nerve. Apart from that, the lateral branch supply first lumbrical and 3 small thinner muscle, while the medial branch supply the second lumbrical. So, how many muscles supplied by the median nerve? First and second lumbrical and 3 thinner muscles. So, total 5 muscles supplied by the median nerve. Now, here you can see this purple color branch, this is the recurrent branch which is very commonly asked in exam, and this branch is quite superficial. So, in the case of the surgeries, if a person will put a deep incision here in this area, he may cut this recurrent branch to the thinner muscles. Now, so what is the difference between the nerve supply of the ulnar and median in the palm? So, in the median, in the palm, median nerve supply the 5 intrinsic muscles which I told you, 3 thinner and first and second lumbrical. Remaining muscles supplied by the ulnar nerve like hypothenor, remaining 2 lumbricals, adductor pollicis and all the interossei. Now, what is the difference between the cutaneous supply of ulnar nerve and median nerve? So, you have to first remember that median nerve supply the 3.5 finger. That means both the side of the thumb, both the side of the index finger, both the side of the middle finger and only the lateral side of your ring finger. Remaining 1.5 sides supplied by the ulnar nerve. So, this is the difference between the digital nerve supply of ulnar and median nerve. Now, there are some important clinical aspects related to median nerve. First, the lesion of the median nerve most commonly occurs at 2 places. First reason is supracondylar fracture of the humerus and second is lower forearm where you have the wound just above the wrist joint. So, whenever this supracondylar fracture, supra means above the condyle, when the fracture of the humerus will take place, it may compress the median nerve. Second thing is that above the flexor retinaculum, if you will have a sharp cut wound here, then also the median nerve will get paralyzed. In both the condition, either the supracondylar fracture occurs or the injury occurs in proximal part of the flexor retinaculum, ultimately the muscles of your hand will paralyzed. Why? Because the nerve supply will start inside the palm only. So, you have the paralysis of your thinner muscle and first and second lumbrical in both the injuries. But in the higher injury, the flexors are also paralyzed. Why? Because the flexors receive the nerve supply in the cubital fossa. But in the lower injury of median nerve, your flexors will spare. So, the denervation of the muscles in the flexor compartment of the forearm and paralysis of the thinner muscles are debilitating. The thumb remain rotated laterally and adducted, and the paralysis of thinner muscles lead to the ape thumb. Now, what is the ape thumb deformity? Now, see, you have to understand that this thumb lies in the plane of your palm. Now, this is the abduction of the thumb. Now, this abduction is caused by the abductors, and abductors of the thumb is supplied by the median nerve, abductor pollicis brevis, and adductor is supplied by ulnar nerve. So, the adductor is working. So, the tone of adductor is keeping this thumb in adducted position. So, the abduction is not possible, and this is the deformity, or the hand becomes just like the monkey or the ape. Then, when you will have the injury of median nerve at elbow joint, or in case of the supracondylar fracture, you have the paralysis of pronator teres and pronator quadratus muscle, because pronator teres supplied by the superficial branch and pronator quadratus supplied by the anterior interosseous nerve. So, your hand remain supinated. Then the paralysis of all the flexors of the wrist except flexor carpi ulnaris and half of the flexor digitorum profundus. So, weakness in the flexion will take place at wrist joint. Your flexor carpi radialis is also paralyzed. So, what will happen? Your wrist is remain adducted because your flexor carpi ulnaris is working. So, there is a action of the flexor carpi ulnaris is there which is unopposed, and that is why the hand is remain adducted. Apart from that, the paralysis of flexor digitorum superficialis and the lateral half of the flexor digitorum profundus, and because of this you have the loss in the flexion of interphalangeal joint at index and middle finger. Why index and middle finger? Why not on the little finger and ring finger? Because the medial half of flexor digitorum profundus is still working because it is supplied by the ulnar nerve. The paralysis of flexor pollicis longus is there. Because of that, there is a loss of the flexion of the terminal phalanx. Then the paralysis of thenar muscle, that will lead to the ape thumb deformity, which I just told you, because of the loss of abduction at the first carpo-metacarpal joint. Then there is a loss of sensation in lateral 3.5 fingers, because we have seen that lateral 3.5 fingers are supplied by the digital branches of median nerve. And paralysis of first and second lumbrical is also there. So when the paralysis of first and second lumbrical will occur, you know that lumbrical is causing flexion at the metacarpophalangeal joint and extension of interphalangeal joint. So first and second fingers are having affected role in case of the formation of fist. So that we will see. Then there is a one more important clinical anatomy is carpal tunnel syndrome. Now what is carpal tunnel syndrome? Carpal tunnel syndrome means the compression of median nerve inside the carpal tunnel. Now in that tunnel you are also having the long tendons of flexor digitorum superficialis and flexor digitorum profundus. So once there is a development of any inflammatory condition, or if there is a overuse of these tendons, what will happen, that the pressure in this compartment is become very high. And you have to understand that the volume of compartment is constant. Why constant? Because posterior side you have the bones and anteriorly you will have a tough retinaculum. So the structures are not stretchable. So the pressure is become very high because of the overuse of the tendon. So tendon hypertrophy may occur, and ultimately they will cause the compression of this median nerve. So perhaps the most important nerve in the hand is the recurrent branch of the median nerve. Why the recurrent branch of median nerve considered as the most important nerve of the hand? Because it is responsible for the movement of thumb, like a position, like it is responsible for the proper holding of the paper, pen. So that's why it is known as the most important muscle of nerve of the hand. Now there is a one more cause of the injury of your median nerve, and that is the forward dislocation of lunate. Now this is again very commonly asked question, which carpal bone dislocation compresses the median nerve? Answer is lunate bone. So once the lunate bone will dislocate, it has tendency to dislocate anteriorly, and anterior dislocation of the lunate bone is also put the pressure on the median nerve within the carpal tunnel, and it is again lead to the same symptoms like carpal tunnel syndrome. Now there are some few important signs to identify the median nerve injury. First is the phalanx maneuver. Now in the phalanx maneuver, we ask the patient to compress their both dorsum of the wrist in this fashion. Now when the patient is doing this kind of the position and compress both the side of the palm, posterior side of the palm, he is having the tingling sensation. And this tingling sensation on the area supplied by the median nerve is a classical sign, and that is known as phalanx test or maneuver. Then you will have Froment sign, then you will have paper holding test, you have Durkan's test, you have pointing finger, index finger test. So these all are the important tests for the your median nerve. Now you have to remember this thing is that in most of the cases where you are having the word P, we are actually testing for the median nerve. For example, you are having the phalanx test, you have paper holding test, you have pointing finger test, you have pen test. There is one more test is the pen test. You have the ape thumb deformity, where again you will have the P. So most of the time whenever you are having the P, you are actually concerning with the median nerve. In the pen test, what we will do is we ask the person to touch the pen. But because of the paralysis of median nerve, he is not able to abduct the thumb. In the same way, we ask the person to hold the paper between your thumb and your fingers. Now he is not able to do this kind of the movement. He is not able to hold this. Or sometimes we will keep the paper here and we will ask to hold the paper. So these all tests are doing to check the power of the muscles and the movement of the thumb in case of the injury of median nerve. Clear? So at the end of this class, now you are able to understand that how the median nerve starts in the axilla and how it will pass through this whole the upper limb to reach into the palm, and what are the muscles supplied by the median nerve and what are the different branches in the different part of the upper limb. Clear? And this is the important thing to understand, that median nerve is not at all supplied any muscle in the arm. It is purely supplied the muscles of the forearm and 5 short muscles in the hand. So this is all for today's class. Thank you.